Welcome back. If you are living with high blood pressure, you understand that every number on the monitor is not just a dry figure. It is a daily reminder of your heart, your blood vessels, and your lifestyle. The good news is that alongside medication, standard recommendations such as reducing salt, exercising, and getting enough sleep, nature also provides silent allies that can support you. Today we will explore 8 herbs that may feel both familiar and new: basil, parsley, garlic, thyme, bacopa, green tea, chamomile, and flaxseed. For each, we'll look at its origins, active compounds, mechanisms, practical uses, and safety notes so you can apply them wisely and with confidence. Let's start with basil. Behind its pleasant aroma lies eugenol, a compound that acts as a natural calcium channel blocker. When less calcium enters the smooth muscle cells of the blood vessel walls, the vessels relax more effectively, peripheral resistance decreases, and blood pressure gently lowers. Basil also contains polyphenols that neutralize free radicals and protect the endothelium, the delicate skin of the arteries that determines their elasticity. Using basil is simple. Crush a few fresh leaves into salads, blend them into pesto, or brew a warm basil tea with 1 or 2 teaspoons of dried leaves steeped in hot water for 7 to 10 minutes. If you are taking blood thinners or preparing for surgery, consult your doctor before using high amounts, since eugenol may slightly affect clotting in sensitive individuals. Still, as a daily culinary herb, basil is safe, pleasant, and helpful. Next is parsley, those small green leaves that appear in countless European and Middle Eastern dishes. Parsley is rich in vitamin C, folate, and carotenoids such as lutein and apigenin. These compounds help reduce oxidative stress on blood vessels and increase nitric oxide release, the molecule that signals vessels to dilate, thereby reducing pressure. Parsley also has a mild diuretic effect, helping the body eliminate excess fluid and sodium, one of the natural ways the body lowers blood pressure. You can finely chop a handful of parsley into a tabbouleh salad, add it to soup, or brew it into tea by steeping 10 to 15 grams of fresh leaves in hot water. Seeds and concentrated parsley oil are not recommended for pregnant women, and people with oxalate kidney stones should avoid high concentrations. If you are on diuretics, monitor weight, blood pressure, and urination to prevent electrolyte imbalance. Garlic is nature's sulfur machine. When you crush a clove, the enzyme alliinase activates and forms allicin, a compound that increases nitric oxide, improves vascular flexibility, and reduces signals that cause constriction in vessel walls. The benefits appear most clearly after weeks or months of regular use. Both systolic and diastolic pressure can drop modestly but meaningfully. Garlic is versatile. Eat 1 or 2 crushed cloves daily. Let them sit 10 minutes before eating to maximize allicin. Add to stir fries, soups, or roasts, or use aged garlic extract that has been deodorized and standardized. If you are on warfarin, high-dose aspirin, or preparing for surgery, consult your doctor because garlic may increase bleeding risk. For sensitive stomachs, consume it with food to reduce irritation. Thyme is not only the aroma of roasted potatoes. Rosmarinic acid and thymol in thyme have antioxidant and anti-inflammatory effects, and they mildly inhibit ACE, angiotensin-converting enzyme. ACE normally drives production of angiotensin II, a signal that narrows blood vessels. By inhibiting ACE, thyme helps the vessels relax and lowers blood pressure. Use thyme in marinades for meat or fish, or brew tea with 1 teaspoon of dried leaves steeped for 8 minutes. Thyme pairs beautifully with lemon and honey. Avoid concentrated essential oil orally. In large amounts, it can upset the stomach. Used regularly and moderately in cooking, thyme is a safe, steady ally for cardiovascular health. Bacopa monnieri, or water hyssop, is a classic herb of Ayurveda. Beyond its well-known effects on memory and anxiety, Bacopa has evidence of increasing nitric oxide production in the endothelium and reducing inflammatory markers, which helps lower blood pressure mildly. The effect takes time, usually 4 to 8 weeks to notice. Standardized bacoside extracts are often taken at about 300 milligrams per day, 20% bacosides, with meals to reduce stomach discomfort. People with thyroid issues, those on sedatives, and pregnant women should consult a healthcare provider first. If you don't use capsules, you can find Bacopa tea, brewed lightly, starting with small amounts to test tolerance. The taste is bitter, but combining it with licorice or peppermint can make it more pleasant. Green tea is perhaps the easiest habit to build. Catechins, especially EGCG, in green tea improve endothelial function, boost nitric oxide availability, and reduce oxidative stress on blood vessels. Brew properly to optimize benefits while keeping it gentle on the stomach. Use water at 80 to 85 degrees Celsius, steep for 2 to 3 minutes, and avoid overbrewing to prevent bitterness. 2 to 3 cups a day is ideal. Avoid drinking too close to bedtime if sensitive to caffeine. People with acid reflux should drink after meals, and those taking iron supplements should space tea 2 to 3 hours apart. Green tea extract capsules can be stronger. If you choose them, start with low doses and monitor liver health. Chamomile is the cup of evening calm. When the nervous system settles, blood vessels stop tightening under stress, and blood pressure has the chance to fall. Apigenin in chamomile binds to calming receptors in the brain, promoting better sleep and easing restlessness and anxiety, factors that can spike nighttime blood pressure. Brew 1 or 2 tea bags or 2 teaspoons of dried flowers in hot water for 5 to 7 minutes. Inhale deeply and sip slowly 30 to 45 minutes before bed. If you have allergies to ragweed or related plants, use caution. People on warfarin should also consult a doctor. Flaxseed is a quiet superfood. To unlock its power, grind the seeds before use. Their hard shells make whole seeds difficult to digest, while ground flax releases ALA, plant-based omega-3, and lignans, compounds with anti-inflammatory and antioxidant properties. Regular intake of 1 to 2 tablespoons of ground flaxseed daily can modestly lower blood pressure, improve cholesterol profiles, and support weight control thanks to soluble fiber. Sprinkle over yogurt, smoothies, or oatmeal, or mix into bread dough. Drink enough water to avoid constipation. Take flax seed at least 2 hours apart from medications. People with intestinal narrowing should consult a doctor before increasing fiber intake. At this point, you may wonder, where should I realistically begin? Start by weaving small pieces into your routine. Morning. After breakfast, have a properly brewed cup of green tea and a bowl of yogurt sprinkled with flaxseed. Lunch. A tabbouleh salad rich in parsley with fresh basil and olive oil. Mid-afternoon, a light-time infusion if you enjoy herbal flavors. Dinner, garlic in stir-fries or soup. And before bed, chamomile tea to end the day peacefully. If you choose standardized Bacopa, take it after lunch consistently for at least a month before reevaluating. Alongside these herbs, don't forget the 3 legs of the stool in blood pressure control, a low-salt diet, at least 150 minutes of exercise per week, and regular sufficient sleep. Losing even 5 to 10% of body weight can reduce blood pressure significantly. Practicing slow breathing at 4 to 6 breaths per minute for 5 minutes a day. Measure blood pressure at the same time daily. Record it in a notebook or app, and let the numbers show what truly works for your body. And remember, these herbs are supportive, not substitutes for medication. If you are on antihypertensives, anticoagulants, or treatment for chronic disease, or if you are pregnant, consult a doctor before adding high doses or concentrated extracts. You may not see miracles overnight. The human body rarely changes by magic. It changes by rhythm. Each cup of tea, each walk, each restful sleep. Nature is always there, patient and generous. Our role is to slow down, recognize its gifts, and make use of them. And when you see the numbers on your blood pressure monitor, remember, they are not a sentence but a map. And with each small adjustment, you are moving closer to the calm and steady land of a healthier heart. Thank you for staying with me until the end of this video. If you found it helpful, please like and subscribe. Wishing you good health and peaceful days ahead.